Today's World Insight. China swings the doors fully open to international arrivals and cargo with easing of COVID measures since Sunday. How has it gone so far? The tipping point for rapid recovery and return to normal?
Here is our host, Tian Wei.
Hello and welcome to World Insight with me, Tian Wei. You are tuned in to our special program, Moving Forward. From Sunday, January the 8th, China has little restrictions on mobility and international arrivals. That's after the country downgraded COVID-19 from a Class A to a Class B infectious disease that scrapped quarantines and arrival restrictions. For its part, China's National Health Commission emphasized the better health care in rural areas and an extension of the policy that insurance temporarily pays for COVID medicines. How well has China's COVID-19 policy optimization panned out so far? And what does it mean for the rest of the world as China eases COVID measures? For answers, let's have our panelists. I'm glad to be joined by Dr. Alice King Kyang-tan, internist at Ms. Medi Women's Hospital in Seoul, Professor Carrie Baumann, assistant professor from the University of Toronto, and Professor Hu Nai-jun, associate professor in the School of Public Policy and Management from University of Chinese Academy of Sciences. Ladies and gentlemen, welcome to the program. All of you have been talking to me over the past few weeks, witnessing step by step the adjustment of policies from China regarding COVID-19. Now, we are seeing the 8th of January, tourists and international travelers, as long as they have visa into China, can come into China without any quarantine, as long as they provide 48 hours test of a negative test. How do you see China is dealing with the vulnerable groups of the population? How is the rural China being taken care of as we speak? How is China likely to deal with the Lunar New Year travel rush, as we are already witnessing at the airport and train stations, even in Beijing?
Well, that's a huge question, I think. Yes, I think as to the vulnerable group, right now, at least in my community, we are beginning to send a kind of healthcare kit to the family who has people are aging 65 and above. That's one example of treating the vulnerable population.
What is in that kit? How is it going to be helpful?
Some kind of medicines to deal with fever, coughing, and of course with masks and some kind of antigen test kit, etc., etc. That's, in my opinion, I think that is just one step to change the resources, including personnel, including medicines to the grassroots. Just as you have mentioned, especially in urban areas, we focus on community level. And in rural areas, I think we have to focus on the village level because that's grassroots. And not only medicines and the resources, but also the personnel, especially the experts' guidance and information to the common people. So I think that is very important. As you have mentioned, the Spring Festival is around the corner. It's the time for Chinese people to travel all around China. I think now we have to make sure that the resources is allocated or reallocated to the grassroots level. And at the same time, what I want to say and last is that it's personnel's responsibility that counts right now. So that is to say, when we travel back to your hometown or your family, you still have to wear masks in public space. You still have to wash your hands. You still have to make sure to keep social distance as long as possible. So I think the responsibility now is on everybody's shoulder.
Dr. Tan, many of the advice Professor Hu suggested, you and I have been discussing about that together with other panelists for a very long time. Dr. Tan, how do you see China's switch or evolution of policies regarding prevention control?
The priority, I think, has been given in China to protecting the most vulnerable. First, through vaccination. There's been a very active campaign to get mobile vaccination units and using education and communication to promote vaccination among especially the elderly. In terms of the, the timing, one issue I have is, and especially this is the case in all countries in the Northern Hemisphere, this is the peak of winter. COVID is not the only acute respiratory virus in circulation. So here in Korea, there's a question about when do we lift the indoor mask mandate? And I've been asked this question many times, and that is really the last mandated restriction that we have in place in our country. And I have advocated for waiting until after acute winter respiratory virus season. So I said, let's wait until spring at least before we contemplate removing this last mandate. And so in terms of the timing, perhaps waiting for a more opportune climate might have been an easier transition point. But in terms of getting the society ready, it's a work in progress. I don't think there was any country that was 100% ready for reopening. South Korea tried reopening at the end of our Delta wave. This was back in October of last year, and it was very difficult. And I think one word of advice is that the policies need to be elastic and adaptive. There will be a need for on-ramps and off-ramps. This is not a a complete definitive road that we're traveling. There will be bumps along the way, and there may be regions that need to pull back again. And I think that's a more realistic approach instead of saying, okay, we're open, we are going to remain open no matter what. Because there will be changes in the pandemic, and there will be future waves. There will be waves of reinfection. There are new variants coming down the road. And so giving anticipatory guidance, I think, to the public in terms of a flexible approach is a wiser approach.
Professor Baumann, the same question to you. How do you see the latest adjustments and the evolution of policies so far?
All over the world, people are walking away from pandemic restrictions. And I understand that, and China is as well, but I would really echo what Dr. Tan has said. One needs no one, not the best epidemiologist on this planet can tell you exactly where this is going. We're still not completely sure. China's a massive country. So is Canada, but we do not have anywhere near your population. And so I do think China's got to keep a very, very close eye on what is going on. And with the approaching Lunar New Year, we have very high vaccination rates in Canada, particularly of the elderly, 90% plus. Many Canadians have had Omicron. But I'll say this, it does come at a price. People are dying of Omicron. There's no question about this. In Canada and many nations, it comes at a price. This pandemic is not over, and we have to be very cautious with that. We have to do everything in our power to protect the vulnerable, as both of our guests have already said, and I would support that wholeheartedly.
One of the things that people are looking very closely is the side effect of this pandemic, the lung infections, for example. We have seen some numbers coming from the Chinese side, specific cities, suggesting about 5%. Of course, the number is not very comprehensive as we speak. The numbers are still changing, and the infection and the infected population is still evolving for the other countries too. But this is a very serious challenge for the recovery of the population and also for the long-term health of the population. I want to go to our international guests first before I go to you, Professor Hu. But now let's go to Dr. Tan on this. Internationally, how are we looking at the lung infections as a result of COVID, particularly with Omicron? How much do we see the roadmap and also the solutions as we speak being drawn upon by the international community?
In terms of lung involvement, we have, of course, people who are severely ill with COVID. They can develop fibrosis of the lungs. They can develop chronic lung disease as a result of COVID. There is also a problem with blood clots that can occur in the blood vessels of the lung. Many people, even if they've had not severe COVID, but mild COVID, complain of shortness of breath after having their COVID episode. And there's still a lot that we need to learn in terms of what's going on at the respiratory membrane, in terms of the exchange of oxygen, the exchange of gases and carbon dioxide. We're still learning what's happening sort of at the microscopic level. What are the changes that are going on? But certainly many people do complain of shortness of breath. Whether or not we can see changes on a CT scan or a PET scan, it's a symptom that many people complain of. And so training people in terms of how they need to pace their activities, how they need to anticipate shortness of breath, what they can do to plan ahead, what sort of activities are safe for them to do. This all has to do with how we live with COVID, because living with long COVID and long COVID symptoms is part of the recovery process.
Professor Baumann, your thoughts also on the same question?
Well, I'm not qualified related to lung disease with COVID and Omicron, but what I can say is one thing we're seeing in Canada, even with the significant amounts of Omicron and COVID that we have now, is fortunately our intensive care units are not surging to capacity the way they were in earlier waves of the pandemic. And that is a very, very good sign. You know, but as other people, I think Dr. Tan has said, I mean, a huge challenge is the climate. And, you know, for Canada, especially so, we're all indoors and we have multiple viruses floating around. We've got RSV and we've got flu and we've got all kinds of things. And we're just coming out of our Christmas, New Year's celebrations. So, you know, we're seeing a lot of infection. It's a very difficult time of year to be making these changes.
I agree with Professor Bowman that even the whole China is not qualified to say how could we deal with the long COVID, because we have just opened up and all the people are just infected recently. So we do not have enough time to see how long will the symptoms or will the infections last in China. But I think this must be an issue in the future because according to the statistics or other kind of papers or kind of analysis, we can see there will be long COVID. And although according to the authoritative statistics that the ratio of people with long COVID may be not that high, for example, 5, 6, 7, 8%, but since the number of population in China is very huge, we have a 1.4 billion population. So I think the total number who will have long COVID is, in my opinion, will be much larger than any country in the world. So I think we must have not only the hospital system, but also a daily health care and health management system to deal with the long COVID, since the long COVID is, I don't think long COVID should be treated in hospital, but in our daily lives. So I think the capacity of healthcare management in daily lives for everyone must be increased, and our country must give every family, every people the capacity to make their own healthcare management.
The world is changing fast. taking all our lives with it. But we can change it too by seeking answers to problems through discussions and debates. On World Insight, I ask direct questions to real people in the know, seek genuine answers, but respect diverse perspectives. Our live global debates tackle the most critical issues head-on. World Insight with Tian Wei go beyond the headlines.
Images may appear to be identical, but looks can be deceiving. The difference is not always obvious. It has to be discovered. There are always different sides to a story. We put the focus on the details. To see more, to understand better. CGTN. See the difference.
Dr. Tan, you are one of the very recent voices I've been talking to over the past 3 years from the very beginning. So tell me more about how do you see authorities of quote-unquote experts, medical scholars, are being challenged, including voices from the governments in charge of health, are being challenged as we speak, as the pandemic evolves?
You bring up a very important point. I think COVID has humbled us in many ways, and an attitude of humility is very important, because we've learned that engendering trust is so important in terms of communication. And as you said, we need to be able to let people know, what we don't know, and what we are on the path to find out. And unfortunately, the speed of the virus has exceeded the speed of science in many aspects. And so people are asking questions for which the answers are still pending. And this has been the case over the last 3 years. And in the interim, of course, that void sometimes is filled with anxiety, is filled with misinformation, is filled with guessing. And so, that's also human nature. We want to know what's going on. And until we have the data and, the scientific answers to really address the concerns, sometimes the best thing to say is, I don't know. And that is not easy for people in positions of authority to say. It's not easy to admit that. But that, in an effect, that also is a way of letting people trust you. Because if you come up with a false answer, time will reveal eventually that what you said was perhaps not the best advice, or not founded on facts. And so I think it's very important to base our answers on the data and on science, and also let people know that the science is evolving. What may have been scientific truth 2 years ago may be disproven. That's how science works. And so educating the people in terms of how we interpret scientific data, how trials are carried out, is important. One important thing that I would like to mention about trials involving especially treatments for COVID, because COVID has so many different faces, it's very important to do randomized controlled trials that are placebo controlled, that are adequately powered. In other words, we need thousands of people enrolled in these trials in order to be able to say, without a doubt, yes, a treatment works above and beyond what a placebo would do. Because it's very easy to say, we tried a treatment and it seemed to have helped people, because the nature of COVID is more than 90% of people who get COVID will recover. And so no matter what we do, no matter what we give, as long as it doesn't harm the patient, the person will recover. That doesn't mean that they recovered because of the treatment. It's just the nature of the disease. And so it's very important that we design trials that are powered to show that a treatment works. And we wait for that data. And once we have it, then we communicate that data to the people and we use treatments appropriately. So yes, it's not easy for people in positions of authority, for medical doctors, for people who are making policy, people in government positions to admit we don't have all the answers. But being frank and honest and keeping people up to date in a timely, truthful way is the best way to engender trust. And that is the best long-term way of getting an information network, an information culture that actually helps with dealing with the pandemic.
I should say we have to learn something from this pandemic. Not only the detailed knowledge of virus, of Omicron, of COVID, but also something about our society, about our management, about our governance. I think right now it is sad that every people should shoulder the responsibility because it is first responsibility to deal with the COVID. But I think at the same time, everyone should have the capacity and enough knowledge to treat any new changes. But right now, I think there must be some kind of understandings. There must be some kind of capacity building, must be some kind of information exchanging, etc., etc. So I think from now on, I think every people should be possessed a kind of analysis of the COVID, should be possessed a kind of knowledge of the COVID. That is the new trend. If you do not possess this capacity, you will be confused because as we all know that China changed the whole policy so quickly. Some people right now still, even me, still have to see my health code whenever I want to go out of Beijing, but I realize that I don't have to use it anymore. So I think from the future point of view, we must make a capacity building to everyone in China.
How is that capacity building being done? Do you
through education, through publicity, but I think also through a kind of, just as Dr. Tan has said, learn to be humble, to respect the reality, to do something scientifically, etc., etc.
Professor Baumann.
My thoughts, we absolutely need to be following the evidence, but what we see in many countries, and I'm not really speaking about China here, by the way, not speaking about China here, is our politicians often interpret things very differently than the medical community does. In the early stages, our politicians all said, you know, follow the science, nothing but the science, the guiding light of the science. And it didn't work for them very well sometimes. And then also the science was changing so quickly that it became difficult. So it's not easy. And, you know, I want to say people need to educate themselves and think for themselves, but we've also had such a backlash with extreme theories and social media misinformation. It's very tough. But look, I'm going to say something I've said before. It does not surprise me in the least that every nation and all of us have made very different decisions about how to deal with COVID. You know, Korea and New Zealand took on a very different position than China, than Canada. Canada took a very different position than the United States. That's very understandable. We have cultural and economic differences, but I think where we really could have done a lot better is global cooperation. We really did not do a great job on that. And I've said this before, and I say it again, early in the pandemic, I'm a person that works globally and teaches global health. I was really hoping that this crisis would begin to integrate a lot of people's communication. Not that we all had to do the same thing, but that we'd all share and work together. And I think we haven't done very well at that. It's quite a shame. And we don't really have a unifying network. I mean, we have the World Health Organization, but not everyone accepts their authority. And we really, really have some major weaknesses globally. We've got an environmental crisis. This is not our last global crisis. And I think that's where we really need some attention and some learning. We really need to think about what we've learned and haven't learned.
From an expert's perspective, Dr. Tan, how do you see our own capabilities to be flexible, to be embracing the realities we are facing, to be able to work on the speed of science, to be able to communicate within a border and across borders? I know we have not done those very well, but Dr. Tan, my key point is what we have learned about ourselves.
Right. It's not just public health. I saw predictions for 2023 that maybe 80% of the countries on the planet will go into an economic recession. And of course, we were all looking forward to maybe recovering from COVID and a brighter future. But I think this is the message that needs to be driven on all levels of society, government, and also from the ground up, that there is no recovery, economic recovery, without pandemic recovery. You can't just hope that you can open up society when you have an acute infectious disease that's causing death and illness, and think that you can ignore the problems of medicine. So I hope that people in every society, in every country, they realize what a long-lasting impact a pandemic can have. And so the next time something like this happens, people know how to mobilize. And education will play such an important role. When I was growing up in California, we did earthquake drills all the time in school, so that if an earthquake happened, every student would know, every citizen, every resident of the state of California would know what to do. So I think we need the same approach. Next time there is an emerging pathogen of pandemic potential, what do we need to do? Every citizen of the world, what do we need to do? And we need to educate the children. We need to educate the public at every level, because we all have a role to play. And so coming up with a pandemic playbook and making sure that it's not just a binder that sits on the shelf of somebody's office, that's not enough. We need to do the research, come up with a plan, and make sure that people are ready the next time, ready to mobilize. What do I need to do on an individual level? What do we need to do on systemic levels, on government levels, and then, as you're saying, on an international level?
Alice Kim Kyung Tan, Carrie Bauman, and Hu Nai Zhen, thank you so much for joining us. All the best. Appreciate it. And that's all the time we have for today. If you'd like to know more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei on behalf of the team. Thanks for being with us.